Hi everyone. Welcome to Dr. Gilead Show again. Today is June 1st, 2017. I want to welcome you back to Dr. Gilead Show. Last week my son graduated, so I wasn't able to make it. We had a graduation party. We were all hanging out. But we're back today on Dr. Gilead Show. We are on WBGR Radio and Facebook Live. Today we're going to talk about prescription medication misuse and abuse. Prescription medication misuse and abuse. I want to say that please do not use what you hear on this platform to make a diagnosis of yourself or of someone else. Do not treat yourself based on what you hear on this platform. It's always good to consult a doctor so that they can appropriately make a good diagnosis and treat you appropriately. Dr. Gilead Show, the producers, the host, and the guests are not responsible for what anyone does based on what they hear on this platform. I mean, we're just out here to pass the message, get the word out, and let people know more about mental health. So please, it's always good to consult a licensed physician who can treat you properly. All right, today we have a special guest. But before I go there, remember you can call on 301-429-9247, 301-429-9247 on WBGR Radio and make your contribution, or also ask a question and we will answer and take your contributions. Today we have a special guest in the house. He is a very special friend of Dr. Gilead Show. He's a pharmacist and he runs a private pharmacy here in Maryland area. He is Prince, Dr. Prince Adekoya Prince. You're welcome to the show. Please introduce yourself to our guests. Tell them a little bit about yourself and what you do.
Okay. Good afternoon, everybody. The name is Dr. Prince Adekoya Jr. I'm the CEO of Paddock Healthcare Inc., a private health specialty pharmacy in Bladensburg, Maryland. I'm also an adjunct clinical assistant professor at the School of Pharmacy at the University of Maryland, Baltimore, in Eastern Shore. I've been licensed pharmacist for about 25 years.
Wow. Okay, thank you, Dr. Prince. Welcome to the show. And wait, I know you've been following us, and you know what we do.
Sure.
So today, like we said, we're talking about prescription medication use and abuse. This is so common, and I know as a pharmacist, you feel the pain that we feel as physicians when people come in with all these kind of problems. But generally, let's quickly look at the common prescriptions that are misused or abused. Mostly pain medications. These are like opioids, oxycodone, Percocet, tramadol, fentanyl, dilaudid, some of those. And also we have some CNS depressants like tranquilizers, benzodiazepines, sedatives, and hypnotics. The other ones are stimulants, the ones that we use to treat ADHD, attention deficit hyperactivity disorder. Dr. Prince, how often do people who tend to misuse or abuse their medications come your way as a pharmacist?
The incidence is getting much more rampant. People are getting a bit desperate these days.
Speak up a little bit so that people can hear you.
People are getting a bit desperate these days. We have instances where people would come repeatedly and add refills on their prescriptions.
Add by themselves. Can you imagine?
And you have also had instances where they would call and pretend to be the physicians and try to call in prescriptions themselves. And instances where they might also go to a physician's office and steal their prescription pad and try to duplicate an existing prescription they had and bring it over to the pharmacy. It's very rampant. And ironically, I find out that it's even much more rampant with seniors.
Oh yes,
Surprisingly, yeah.
yes. We're going to look
Yeah.
at some statistics here. You know, it happened to me. I was called up by a pharmacist in Northern Maryland, up that way, and so someone had brought a prescription of alprazolam, Xanax, and she said, "Well, I have a prescription from you here, but I don't think you wrote this. Do you practice up this way?" I said, "No." So I said, "Where is the patient?" He said, "Well, I asked him to sit down, and the patient was sitting down, and they called the police. And some months later, the police called me and said I would come to the court to give evidence, but I think the guy pleaded guilty, and he got 7 years. He got 7 years for forging my prescription. So, but I never went to court. So it's really rampant. I saw some statistic, Dr. Prince, that is estimated that 54 million people, more than 20% of people aged 12 years and older, have used prescription drugs non-medically. That is, they've used it for a reason for which it was not prescribed, at least once in a lifetime, in their lifetime. That is 20%. That is huge. 54 million people. And also, it's estimated that 2.1%, 2.1 million Americans use prescription drugs non-medically in the last 1 year. So it is not a child's play. It's a very common thing that happens all the time. And the statistic was saying that of the people, 54% were females.
That's very true.
That corresponds to what you see.
That's what we see in practice most of the time, and they come with various reasons. Just like I said, it's even more prevalent in seniors, the elderly, which is kind of surprising because the focus is not only on the younger population, the adolescents, the middle-aged people, but you find out those people are kind of, apart from the adolescents, the middle-aged people don't tend to indulge in that kind of practices. Normally common with the seniors and adolescents who are normally acting their age
right.
with improper guidance.
Mm. Yep, it was unbelievable. I mean, 54% females and 30% were most adolescents, which means a lot more people were the older population, like you just said. But that could also be because the older people have a lot of medical problems, in pain more, or must have been on pain medications long enough that they've developed tolerance or dependence to it. So,
well, that's very true, and it's not unexpected because people in that age group normally we have issues with arthritis,
yes.
and based on the kind of relief they need, the opiates tend to be the ones to give them the best relief. It might not solve the underlying problems, but they do find more solace in using that, and they will go out of their way to get that kind of relief, pain relief or resolutions, if that's what's going to give it to them. So what I find out most of the time is they tend to overuse the prescribed portion of their prescriptions, and before you know it, they run out of it, and they're desperate to have pain relief, and they go out of their way to do anything possible to get this opiate. And with the adolescents, you don't have much except for maybe students who would tend to use that to improve their concentration. So the chances of that overriding what you see with the seniors is kind of very minimal.
Very minimal. But you know, recently I've had an upsurge of college students asking for ADHD medications. And they come, and you see, these are smart young people. They know all the symptoms of attention deficit hyperactivity disorder. And hey, there are, when they take the test, the testing for it, they score very high on ADHD spectrum, and you can't say they don't have it because you want to restrict writing prescriptions for those stimulants. So, but at the end, I found out that they give it to other students. They share it among themselves, and it's really getting rampant. Well, it says that taking meds to get high is called prescription drug abuse. So misuse is when they take more than prescribed, but when they take it to get high, or to get a buzz or to have some good feeling, euphoria, it becomes prescription drug abuse. It has become a public health problem.
Yeah, it sure has, especially with the break-ins into different pharmacies.
Yes, I heard about that.
Yeah, they have that very often. People are very desperate, and even when they bring in the invalid or fake prescriptions, as we call them, you find out they get very aggressive, very desperate, and very confrontational. And in that instance, you find out that they start using words as being discriminatory. You're the pharmacist and the physician are trying to prevent us from getting our pills. Is it because I look a certain way? But that's not really the case. The case is that they're just trying to make the practitioner feel guilty and, hand tie them to do what they, do their bidding.
Right. So they do everything they can to get the prescription.
Exactly.
Because possibly they've taken too much, they're running out. And of course, the doctor will not re-prescribe it until it is time for them to get their prescription.
Especially when they're experiencing withdrawals.
Exactly, withdrawals, especially from opiates, even the hypnotics. Yeah. Well, so what do you think? What could be the reason why people abuse these prescription medications or overuse them?
Well, sometimes it's the society not facing the facts and dealing with the problem headstrong. Everybody's trying to be politically correct. And in so doing, people are not calling a spade a spade. They're trying to hold back so that they don't get, kind of marked or kind of stigmatized in a way of being discriminatory. So the problem basically is mostly societal, political basically, and also the fact that the control systems do not address the cause of the issue. Rather, they're trying to nip it at the bud by just catching scapegoats. If the system is really serious about cutting down opiate abuse, they will do much more than just trying to catch implicate practitioners who are involved. Because most of the practitioners are hand-tied based on the scenario you gave.
Yes.
People come, they know how to act when they're being diagnosed, and you have no option because there's no basis for you to say no. Because the only basis is the template for you to diagnose them. And when they come over to the pharmacy, we basically would verify with the physician, and when the physician says, well, I have a valid reason to give it to them, why would you not give it? But, agencies like the Drug Enforcement Agency should do more in working with practitioners to try to find the underlying cause of opiate abuse.
Yep, I think it's one of the things we're going to talk about. So, another reason possibly people may abuse prescription medications is the belief that, well, it's being prescribed by the doctor, so it doesn't have any bad effect. Or, like if you're doing cocaine, they tell you cocaine could cause you a stroke, heart attack, and all that. Well, this is well-known medication prescribed by my doctor, so it's not going to cause me any problem. So they don't feel that it could be dangerous as well.
Well, I agree. Yeah, that's very true, and that's why I see the approach by the government to address this issue has not really been kind of very practical, because look at the issues with the knock and the spray.
Yes.
Where they give knock and spray. I was driving down to work this morning and I heard on the news that there's a big opioid abuse incident in Pennsylvania, and there's been instances where they even go to the public library to overdose on heroin.
At the public library?
In the public library, and all the society is basically doing is empowering them by giving prescriptions for Narcan.
Yes.
And maybe once in a while, training people to be able to help people with overdose. But that is just part of the solution. It's not really going to address the root cause of the problem.
Right.
And the root cause of the problem will involve a large-scale grassroots education at schools, with teenage, even with the seniors. People need to educate them more, and create the opportunity and the incentive for providers to also spend time with their patients to educate them more on the need to stay within the ambit of the prescription dosing that was, given to them.
Okay. Well, we're going to get to some where we may proffer some solutions. Um, now, let's. I saw here in my while preparing for this, it says that young adults 18 to 25 years, 4.4% do abuse or misuse prescription medications. And the teenagers, 12 to 17 years, 2.6%. But once you hit the older age group, it goes to 50 something percent, which is what we're just talking about. He said that after alcohol, marijuana, and tobacco, prescription drugs are the most commonly used among 12 graders. That is dangerous. You know,
Well, it's the same path as you see with tobacco and alcohol, just like you stated earlier. The same kind of influence you get, the same kind of peer influence that you actually see within this kind of age group.
yes.
Normally in high school, that's where most of the vices are being committed, and that might be the area the government might want to focus on to kind of cut down on drug abuse or misuse among adolescents.
Adolescents, yeah. So, in your practice, as a pharmacist, how often do people come requesting or trying to get more medications like opioids, or, like fentanyl, oxycodone, and all that?
It's kind of very funny because they come very often. You have people come from 20, 30 miles trying to pull a fast one in the pharmacist.
Mm-hmm.
And they come with a very, very nice attitude initially till you tell them, well, you're coming from a far area. It makes
Yes.
no sense going past several pharmacies to come to our pharmacies 20, 30 miles away from where your doctor.
So that raises your flag,
it
right?
raises a flag, and basically you look at it and say, why? Why are you coming over? And you will be very surprised how the conversation changes from a very cordial kind of conversation to a very confrontational argument. It puts the pharmacist in a very tight corner because you try to put a straight professional face,
Right.
and the person is in your face and telling you, you must give me this narcotic.
But initially, though, how do you identify this kind of people?
Well, you also, as a pharmacist, you also have to ask on, pertinent questions, Also, why did you come from a far area? What's the prescription for?
Yes.
What's really wrong with you? You would try to find a way to uncover this in a very conversational way without looking like you're passing judgment on the patient.
Having said that, I had a neck pain, and my doctor prescribed oxycodone for me. I went to a CVS, and I'm a doctor, I prescribe, and in the area I have patients in the pharmacies all the time, so I get in the prescription, and in such a loud voice, he said, what are you taking this oxycodone for? I was so embarrassed. I looked around, none of my patients were there, and I looked at him. I told him, I said, man, why are you so loud? You're embarrassing me. He said, no, people are abusing these drugs. I said, I know, I'm a doctor. He said, well, I don't care if you're a doctor. So I don't know, how do you handle these? Because sometimes it could be really embarrassing for people, and they feel profiled, maybe another race or something else. How do you handle it?
Well, first of all, when you screen the prescription, there are normal questions they have to answer, fill. Then you look at the address and see, oh, this doesn't look right. You look at the dosing, and the dose looks out of whack, or the quantity looks out of whack.
Right.
And you basically would now call the patient aside. Most pharmacies are now encouraged to have a counseling area,
okay,
or a private area where they could actually have a private conversation with the patient. So that scenario you gave is kind of unruly.
I think it was unprofessional.
Unprofessional.
Yes.
But we can't really blame that pharmacist, even though what he or she must have done was quite out of line.
Right.
The problem is the pressure is so much that even in some of these chain pharmacies, they throw them under the bus. They tell you have to make that call. And we're not going to assess you based on the number of narcotic prescriptions narcotic prescriptions you see.
Yes.
And so there's so much pressure, and you have the drug enforcement agency coming, the drug control people coming around. Everybody's already, it's just like walking on an eggshell. Well, the best practice is to call the patient aside, go to the private area, the counseling area, have a one-on-one with the patient, and lay it out to them. However, in some instances, what you find out in most pharmacies is they'll tell you, we don't have it in stock. Because that cuts down the whole,
Right.
this
Conflict, yeah.
conflict, yeah, because most of the time you tell people, we can't give it to you, they start saying why. You still have lots of patients to see, and this one person is telling you, hey, you have to give it to me. Why can't you give it to me?
Right.
And you're telling them, look, based on this criterion, they will never reason with you. So the best thing is to do is go to a private area, try to reason with the patient. If not, and you feel that the patient is really out of the range,
right,
and it doesn't look right, two things you can do as a pharmacist is to call the physician who wrote the prescription,
right,
and verify the prescription, get a diagnosis, get the rationale for it, document it on the prescription. But if you're not okay with it, just hand back the prescription to the person and tell them, wait, I can't fill it. Obviously, if the person gets unruly, then you call the cops.
Yeah, you have to stay safe. And your license is also on the line.
Yeah, exactly.
So,
yeah.
And these opioids are similar to heroin. In fact, he said that fentanyl is about 18 times more potent than heroin.
That's very true. And
yeah,
you even find some of those young ones actually have found a creative way to get the fentanyl out of the fentanyl patch.
Oh my God.
And kind of get it into solution and try to inject himself or sniff it. It's very, very, it's a very endemic situation that needs to be nipped in the bud.
Right. I was checking on the streets. Sometimes they crush the oxycodone, crush it and snort it.
Yeah, the manufacturers helped out in a way because they put a deterrent in there, a gluey kind of deterrent, so crushing it is no longer attractive for them, which kind of cut down on the need or the demand for OxyContin as a drug itself.
Wow.
Now, the emphasis have now shifted over to oxycodone, the plain one.
The plain one.
And that's what you find people breaking pharmacies into or holding pharmacy stuff because they need to have that, and that's the only recourse they have. If they don't do that, they go to the fentanyl patch and try to, get their high from there.
Wow. So this is a huge problem, public health issue that must be addressed. Now, of course, like you said, when you snort some of these things, it could damage the nasal mucosa. If you get IV, I mean, how can you crush a pill, dissolve it in water, and give it IV?
Why?
You can transmit, and an infection can go through the needle, which can infect your heart valve, cause endocarditis. I had a patient who injected himself on the arm, but he hit an artery instead of a vein. So the four fingers here went gangrenous. And he didn't go to the hospital. He came to me and I said, what happened to your fingers? Oh man, I tried to inject, I hit an artery. I said, you need to go to a hospital now. You know what? He did not go. By the time he saw me the next month, the 3.5 fingers were gone. They were dark as tar. So these are some of the dangers.
Yeah, apart from that, you have the increased risk of hepatitis because these people do share needles, HIV, and all this kind of public health diseases that which on their own actually is a problem that needs to be calmed down. But the problem there is this kind of practices actually do come with increased risk, and that's what you just pointed out.
Right. So I want to point out here for opiates, which is one of which are one of the which is a part of the medications that are abused. Some of the side effects when people, whether you snort it or you inject it, it could cause sedation, dizziness, vomiting, decreased respiration, which is the major problem. Why these days we've had multiple deaths, especially when they mix up medications. So people have decreased respiration, it knocks off the respiratory center in the brain, and they go to bed and they don't wake up. Recently, we've had multiple problems from respiratory arrest, low blood pressure, hypertension, and of course slowed heart rate. The heart can no longer pump at a regular rate, and at the point it stops, and the person dies and never wakes up unless he's lucky and some Narcan spray, somebody catches you and gives the Narcan, and they wake up is magical how it works. But I mean, recently I had a patient. I heard about a patient that I used to have some years ago. She was clean, got a job, got her son back, but she went out to do drugs. And when her friends found out that she was sleepy and groggy, they left her in the car. And she was found dead the next day in her car, when they should have actually called for help, and she would have just been taken care of. Go ahead, Prince.
Well, the issue that basically that normally causes, they normally mix this with alcohol, mix it with all the recreational drugs,
Yes.
and the compounded effect is normally CNS depression,
Yeah.
which normally could affect their their breathing. It
Yeah.
slows down their breathing, and that could be a big risk when they're asleep,
Yeah.
or in a situation you raised where the person was left in the car,
Yes.
with no provisions to engage the person or kind of resuscitate the person. It's always an issue. But what I would say is, even for people who do use it appropriately, try not to use this kind of medications with alcohol.
Yes.
Don't mix it with recreational drugs. The risk is so much. That is very obvious. It could be a big consequence to that. But the long-term effect, especially when you inject it, is just the complication is just so much.
Yes, it's too much to it's not worth the trouble.
Yeah.
There's a statistic that every day in America, 40 people every single day die from prescription opiate overdose.
Yeah, either intentionally or
Intentionally, yes. Sometimes I think few people would intentionally they just want to get high. But Dr. Prince, the one that really touches me is someone dies from overdose of pen pills plus fentanyl or some heroin. People run to the dealer, whoever the dealer they got the medication from or the substance from. People say that gives a strong high. People run to that person when someone has just died from it.
Well, that's the egg crate that we all work as healthcare practitioners, especially when we have to deal with this kind of agents. Physicians are also trying to pull back on writing so much of this narcotics or opiates. Just the same way pharmacists are trying to pull back on it. And the reason for this is just the fact that instead of addressing the issue and managing the patient, the system is trying to stigmatize the prescribers and the dispensers of the medications.
Yes.
And that's why you see a pushback by these practitioners and not trying to deal with this kind of agents at all. However, the downside of this is that people really do need this medication, do not get it, because there's a mindset that everybody who gets it will get the practitioner in trouble or are actually going to end up abusing it. So this is the pushback we have, and this is the challenge we have to be able to overcome, to make sure that these drugs are being used properly and the people who do need it do get it, not because of the stigma that the abusers have actually placed on these drugs.
Yes. So really, question for you. Can a pharmacist, and I know you got into this a little bit, can a pharmacist say, I'm not going to fill this prescription from this doctor, even though you call the doctor and the doctor says, for example, say I give a prescription and the patient comes to your pharmacy and you call me, I say, yes, well, I saw her or him and I think he has pain or he has whatever condition for which I'm writing the prescription. But can you say, I'm not going to fill this prescription even though you have it?
Well, the only circumstances is the pharmacist is not a diagnostician, so we cannot override the physician in that regard. However, we've done the due diligence in calling the physician, finding the rationale for the use of the medication. However, the circumstances under which a pharmacist can say no will be if there's an established pattern of abuse, which the pharmacist will have to relate to the physician or the prescriber.
Yes.
Also, another scenario will be a scenario where there's no established relationship between the practitioner, that's the prescriber, and the patient. You've had situations people might just write prescriptions and there's no active relationship between the prescriber and the patient. In that instance, once the pharmacist sees that flag, all you need to do is document that, make that known to the prescriber that I see that there's no established relationship with you and there's no basis for you to write that prescription. Then you could actually hold back. But it's an egg crate. It's a very thin line between what to do and what not to do. So you have to be able to justify and rationalize appropriately what will make you say no to a prescription.
Yeah. Yeah, you know, I get calls, I guess pharmacists trying to confirm that that prescription came from my office. And pharmacists have been so helpful. Sometimes they call, are you aware this patient is on this medication? Whoa, no, I wasn't aware. Please do not dispense that medication. So patients come to me, they don't tell you exactly all the other medications they are taking. And you prescribe something which you know that if they combine what they're taking with what you've just given, they may go to bed and not wake up. So pharmacists will point it out, and I said, no, please don't fill that prescription. And I have had situations where a patient of mine filled same prescription but from another physician and comes to me the next week and takes the same prescription there. And the pharmacist calls me. I just filled this prescription from his primary care. I say, okay, thank you for calling me. Don't even fill it. Tell the patient I said don't fill it. And the patient never came back to me again.
And basically what this is a very good practice where a physician acknowledges the fact that the pharmacist reached out to them. We've had a situation some physician would say, well, you can't question my prescription. I've been writing this for years. Don't give me a call. You're disrupting my flow for the day. And you've had scenarios where the physician, that kind of physician, didn't realize that the pharmacist was trying to
help him.
Yeah. He or she, and also the patient, because one thing most people have to acknowledge is the pharmacist is the person who actually sees, especially when it has to do with drugs, the different prescriptive medication used by the patient, and the prescribers who write prescriptions for particular patients. So it's the pharmacist who could actually put a stop to issues if it's going to go out of whack, especially if the prescribing physician doesn't know that the patient is actually on another agent that is similar or might interact with the one they wrote.
Exactly.
Scenarios you have a prescriber write oxycodone, 30 milligrams, up to 90 or 120 milligrams, and the same patient goes to another prescriber and gets another prescription for morphine or OxyContin again.
Right.
And what you're doing is you're actually having a opiate overload on that patient, which could actually lead to the consequences we actually stated: slow heart rate, respiratory depression, even death.
Death, yeah. So I think the pharmacists are they are in a good position to help the doctors. And I think my advice to my colleagues is when the pharmacist calls you, listen first. Because sometimes I've gotten upset too. Hey man, why are you calling? And they say that, well, okay. I sit back and listen to what they're saying, and it's been very, very helpful. So, but also, I think the way patients may beat that is going to a different pharmacy to fill it. Even though we have a central monitoring system these days, but it is overlooked by the pharmacist.
Monitoring portal that all the prescribers and dispensers could actually check. And that's one of the tools we as pharmacists use most of the time to find out if the patient has been doctor shopping or pharmacy shopping. That's the term we use for this kind of abuse.
Right. Yeah. Well, ladies and gentlemen, we are on Dr. Gilead Show, talking about prescription medication misuse or abuse. And our special guest today is Dr. Prince Adekoya. He is the owner of Paddock Pharmacy. Paddock Pharmacy is right there on Bladensburg Road, and his phone number, the address is, Prince, where's your address?
It's 5403 Annapolis Road in Bladensburg, Maryland.
5403 Annapolis Road, Bladensburg, Maryland. And the phone number is 301-277-7107. 301-277-7107. I've seen Prince help out a lot of patients, so you can always use his pharmacy. But don't go away, we're going to take a few minutes break. We will be back shortly.
Imagine people would like you to travel back in time to witness the first reported case of identity theft as we present Stolen Identity, the story of Esau and Jacob, this Saturday, July 25th at noon and 4 p.m. Admission is free, but you must have a ticket to get in, so call 301-249-9400. That's 301-249-9400. Stolen Identity.
It's an effective approach to restoring balance, whether through the supply of vitamins and minerals, micronutrients and proteins, or by taking advantage of the health-promoting effects of botanical compounds. Our connection to nature is profound, and our expertise in understanding how the molecular components of nutrients support our own biological processes allows us to develop unique and effective products for enhanced and well-balanced health. That is the AdvoCare advantage. AdvoCare offers
You almost
superior
won.
nutrition,
Yeah, you're
wellness,
okay.
and your lifestyle change today. Contact
All right, guys, welcome back to Dr. Gilead Show. Thank you for staying on. We are talking about prescription medication misuse and abuse today on Dr. Gilead Show, and my guest is Dr. Prince Adekoya, the president of Paddock Healthcare Pharmacy, a privately owned pharmacy. We are on WBGR Radio and on Facebook Live. You can call on 301-429-9247, 301-429-9247 if you have a contribution or a question about medication. Dr. Prince will be willing to answer. So we're talking about prescription medication abuse or misuse. Dr. Prince, some of the another set of medications that are misused or abused are sedatives. How often do people come with that? I know that the opiates are very common, but what about sedatives? Things like Xanax. People come to me and say, "Hey, doc, I want Xanax bars." Man, what are you talking about? Just give you Xanax bars? So how often do you see people playing pranks or trying to get some extra Xanax from you, or Clonopin, or any of those?
It's almost the same demographics when you look at it. The same teenage getting a buzz from it, or seniors who actually have problems with insomnia or muscle cramping issues. They tend to kind of find ways around the system to get this medications any way they could. You also have another classic group of people who are very, very enlightened when it comes to cocktails of these drugs. A surprising part of this cocktail will be clonidine, which is used to enhance the effects of these sedatives,
Right.
hypnotics basically. They do come very frequently. They're a bit more subtle in the approach. They're not as confrontational as the ones on the opiates.
Yes.
But the downside of it is that most of them end up dying
Yeah.
from overdose
Right.
on this medication, or cocktails as we call them.
Mm.
Typical one is normally Xanax
Yep.
with clonidine and some other inhalation medication that they kind of cook together and kind of sniff most of the time or inject. They dissolve them and inject them.
Yep. I mean, I found out that Xanax, they crush it and snort it, or even mix it up with some liquid and inject.
Inject, yes.
What is this? But anyway, hey, Victor, thank you for tuning in. Charlotte and Brenda Brown, I see you. Thank you very much for tuning in today. You can ask any question or send us a tweet, and we would acknowledge it, and we will also answer your questions. Now, sedatives. I want us to talk about sedatives. What are the major problems that can happen with sedatives? Of course, they are called sedatives, so they can cause sedation. They make people sleepy and drowsy, and that makes coordination very poor. Driving, people get into accidents. As a matter of fact, I saw a patient yesterday. He has a lot of pain issues following a motor vehicle accident, but he was a passenger. He did not know that the driver had just taken 4 milligrams of Xanax.
The effect is basically just like taking alcohol.
Yes.
I'm sure most of us had the story about Tiger Woods recently.
Exactly,
He
yes.
pulled over.
Yes.
And it was thought that he was under the influence of alcohol, but he was actually under the influence of prescription medication, which
yes.
actually made him very drowsy. The risk is accidents, and poor coordinations. It's even of greater significance in seniors. There's what we call the Beers list, where the drugs that causes drowsiness or sedation.
What is that list called?
Beers list.
Bears list.
It has lots of drugs. It actually spans drugs like sedatives, hypnotics, like this opioids, and also drugs used to calm patients down, like tricyclic antidepressants.
Right.
People use this for pain. Diabetics could use it too. So it doesn't really have to be somebody who has sleeping problems or severe pains. You do have diabetics who use this kind of drugs to calm down neuropathic pains or symptoms, basically, and they think it's not a big deal because it's part of their regimen, but it actually has greater significance, especially if they have to drive.
Right, but also if you're diabetic, when the blood sugar drops, if you are on these medications, you're not going to feel you're not going to feel the effect of low blood sugar, and that could cause a bigger problem of brain damage. But that combination can really kill the patient.
Exactly.
Yeah.
Exactly.
So and these sedatives, when combined with opiates, it knocks out the respiration, and they go to bed and don't wake up. I had a very bad experience. A patient of mine doing very well on clonazepam, Klonopin, but the brother who lives in the same house had been to a rehab. That night the brother came back from rehab. They bought some beer, and she had not had beer in a long time. So she drank a few beer with the brother, and the brother saw her. She couldn't go back to her room to sleep, and the brother said, okay, you can lay down on the floor there. The next morning, Dr. Prince, she was stone cold dead.
That's not surprising.
Yeah. So, and I went for the funeral. When the daughter told the story, I felt so bad. But this is one of those problems, combining alcohol with any of these sedatives, very dangerous. Do not do it.
Also, the age-long warning to keep medications away from children's reach, and also keep your medication in safekeeping is also very good advice, because one of the things you find out is people leave their medications out in the open. They get guests in their house who are very, very mischievous. They go there, steal the medication, and abuse the medication. And sometimes it's also to the disadvantage of the person who owns the medication, because if they're using it for legitimate reasons, they're now short of the medication. And this same patients will go to the pharmacy, and they will be told it's too early for you to get the medication because the course you were supposed to use was for a certain duration of time. You've allowed somebody to steal your medication who might likely go sell it on the streets,
right,
abuse it, or cause harm to somebody else. So these are things we need to look out for. As much as we're addressing the issue, we also have to look at our own ways we can actually curb those kind of behaviors.
You know, I hear, you can't imagine the amount of stories I hear. I have someone on 3 or 4 medications, but they come to me, hey doc, my Xanax fell into the toilet. My Xanax was stolen. my car was broken into, and so why is it that it's your controlled substance that is always stolen? So and sometimes it could be true, and I said, get me a police report. Once you get a police report, I re-prescribe it, but they have a hard time because insurance will not pay for it. So what Dr. Prince is saying, keep your medication safe, in a very safe place where strangers, even family members, will not be able to get to it. That way you are protected, your medication is protected. You don't need to run back and forth between your doctors and the pharmacist trying to get more or before it's time for your next prescription. Hi, I see Miss Ajoke from Nigeria. She's a nurse. Thank you for tuning in today. We're talking about prescription medication abuse and misuse. All right, Dr. Prince, the other group of medications that are abused is CNS stimulants, the amphetamines, the Adderall, Concerta, Vyvanse, and all that. Is that common too? How common is that compared to the other two we talked about?
Yeah, my practice is close to the to a couple of colleges. I wouldn't name the colleges. I don't. That's no problem. But you know, you tend to see students, especially very close to examination periods, end of semesters, trying to get a kick so they can stay alert and improve concentration. You tend to see them coming around with prescriptions for amphetamine, Adderall, and the likes of those kind of drugs to enhance concentration. This is another form of abuse, even though it doesn't give them a high, but it also has its own consequences and significance too in terms of the side effect profile this drugs, kind of pretend. Basically, there's been an uptick of that recently, and just like we do with other controlled substances and narcotics, we tend to vet the prescription very aggressively.
Right.
Try to get the correct diagnosis of the medication and try to see if there's been a trend or if it's just a stopgap situation where they just need that kick to stay for the exams,
right,
and go on from there.
And the stimulants, ladies and gentlemen, have severe side effects. I know you want to stay up and study, or you want to feel like upbeat. They can cause severe insomnia, headaches, severe loss of appetite, and of course weight loss. Some people have abdominal pain, palpitations, your heart is beating fast, and one of the major side effects of stimulants is heart attack. They could have myocardial infarction because the heart is beating so fast, so much tachycardia. It is advisable, unless you absolutely need this medication, do not take it, and do not take it from friends. People have had even psychosis. I have a patient who he feels that his mentation, his thoughts are slow, so he says he has ADHD. Adderall is prescribed. He takes a little, he feels good, but before middle of the day, he's slowing down, he takes more. So at the end of the day, he takes about 6 pills of Adderall. But the good thing is, he has noticed that when he does that for 3-4 days, he begins to become paranoid. And he hears voices. He thought that everyone at his job was against him, and he had no idea where that thought was coming from.
Seizures is another consequence that is, where they're a consequence too in this kind of class of people. And you tend to see that they don't only just do the stimulants, they also do recreational drugs alongside with it. And
yes.
That increases the risk of seizures.
Seizures, yes. It's very, 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 very common.
Stroke is another consequence. I've found out. I've seen that very frequently. But the incidence is not as much as I see with seizures in my practice.
Yeah. So, well, how do we manage this? How do we prevent this from getting worse? I mean, I think it starts with the individual. I mean, I think we should, first of all, the patient should, maybe with the prescribers. I know recently, well, not too long ago, the teaching was no one should suffer from pain. So the tendency is to prescribe. pain medications. Once someone hits the emergency room, the ED physicians give you a little pain medication, you're out. Or you have some anxiety issues, they give you Xanax and you're out. But what I have found out is a lot of the people who are addicted to pain medications, even heroin, were originally started on prescription medication by their doctors. The question is, why would two people take, say, OxyContin for pain, one person gets addicted to it and the other person resents it and doesn't even want to do it? So I think is some way our brains are wired. There are people who are prone to addictions and some people are not. So even if they take it for a whole month, they just stop. But the other things, they go through withdrawals.
Well, that's a big one there. But I think going back to what you just raised now, pill sharing is one of the consequences, and that's a consequence of peer pressure, where somebody who actually has a legitimate use for the medication feels that, oh, this gives me better concentration when it's time to go for exams.
Yeah.
The person says, oh, can you give me a pill? And they share the pills. Person gets that. And also another influence you get actually attribute to this kind of scenario is the influence of the internet. People self-diagnose themselves.
Yep.
Self-diagnose themselves with attention deficit disorder or, those kind of ailments. And what you find out is when they do that, they put pressure on the prescriber to
give it to them.
Give it to them.
Yeah.
And normally, because they already have a mindset that they do have this, they mimic the classic presentation of the actual patients, and the prescriber has no option.
No
option.
option. Yeah, some people come to me, they give me the classical DSM diagnosis of attention deficit hyperactivity disorder. Mm-hmm. You give them the testing, they score very high on it. Why won't you give it to them? Exactly. So that is a problem. But I know that due to the epidemic of misuse and abuse, the federal government launched an initiative for reducing opioid misuse and overdose. This was by promoting more caution. Physicians are advised to be more cautious in just dishing out these medications. And it is called responsible prescribing. So don't just throw it out there. You have to be sure that the patient really has that problem before you prescribe it. It doesn't matter. They may not be happy with you, but you're doing what is absolutely right. So, and it's a lesson for all of us, prescribers, physicians, nurse practitioners, or even physician assistants, if they're licensed to do that. Always make sure that you're doing the right thing. Dr. Prince, how do you think pharmacists could really help with these problems?
Well, spend more time counseling the patients once they identify a scenario or a trend towards abuse. Another thing to do is to work very closely with the prescribers. If it's very possible for the system to generate an avenue where we could actually share more information about the patients prior to their coming to the pharmacist or even their physician, that will also aid in trying to curb this kind of scenario or incidences as much as possible. But the key thing is education, and the practitioners being very particular about following due diligence and trying to make sure that they follow up with their patient and promote more cautious use of the medication.
Which, I mean, these things that Dr. Prince marshaled up will always help in covering this. But for the patients, what can we tell them?
We have to really tell the patient that it's even a federal crime to share pills. It's always on the labels. I know most people overlook it when they look at the labels, but it's actually...
Is there on the labels?
Yes, it's actually a regulation that pharmacists must put a sticker on the bottle stating that it's against federal rules for patients to share their medications with other people. It actually has to be used for the prescribed indication.
Right.
But most importantly, the issue there is it starts with the patient. A patient should actually know that there's more risk in trying to get a chill pill, as we call it, or
Chill pill.
as they call it.
Yeah.
I don't call it that.
That's a street name or
Street
something.
name. There's more hazards to it, and the more they look at their health and from a holistic point of view, and not try to cause more complications to what ailments they're having, they should be able to change those habits.
Okay. So hey, Taro Clark, thank you for tuning in. I see you. Thank you. We're talking about prescription medication abuse and overdose. Thank you for tuning in. So, well, people out there, patients, you must follow the direction as given down by the pharmacist or as your doctor told you. And also, I think we must give the patients good education about the medication, drug interaction. Sometimes people may not know that, well, if I take my Percocet with Xanax, it could kill me. And what I do as a physician is, once I prescribe a medication, I tell them, you cannot drink alcohol with this medication, and I document it. You cannot take this other medication with this, because it could kill you. Sometimes people don't want to hear it, but you have told them you have given them the information. So, and also I educate my patients, don't take more than prescribed. Stick with the dose, and if it's not working for you, come back to me and tell me it's not working, and I can tell you on how to adjust it. Yesterday, a patient of mine, the relative told me he doesn't want to see me again. I said, why? Oh, he says you're not helping him because he's on methadone. He's depressed. He has anxiety disorder, but he insists on Xanax. And I said, you're on methadone. The combination of methadone and alprazolam could kill you. Oh, well, I've taken it before. Well, I'm not going to prescribe it. And he came, we fought through this for 3-4 months. Yesterday, finally, he refused to come. He says, I'm not helping him. But you know what? I heard he goes to another doctor in Annapolis, and the guy is giving him 2 milligrams of Xanax 3 times a day. But what I don't know is if that prescriber knows that he's on methadone. That is what I don't know. So, and I'm asking, trying to get the name of the physician so I can really warn him. So this is what healthcare providers, the difficulties we face.
Yeah, but what I would advise is all healthcare providers having anything to do with the use of these agents in managing their patients should always use the drug monitoring portal to make sure they actually get more information, because these patients are very, very cunning. They basically doctor shop, they pharmacy shop, and the bottom line there is we really have to adopt the interdisciplinary kind of approach where we all talking to each other, we all communicating to each other, we all using the tools that are provided for us to see the use or shopping patterns of these patients, because they basically shop around all of us, be it the pharmacist, be it the prescriber.
Yeah.
So we need basically to find a way to communicate more and try to educate the patients as much as you did with this particular patient you just described. More importantly, patients should also declare what other medications they're using to their physician and to their pharmacist or their prescribers whenever they're being prescribed medication, because you're not getting a good response to some of this medication might be due to a drug interaction that's actually impeding the effect of these drugs. It's known that some of these drugs compete for the same receptor sites, and you might not have the same kind of response you desire most of the time. Also, another issue is people do use over-the-counter medications, herbal supplements, which could actually have very major interactions with this medication.
Cough syrups and all that.
Cough syrups, herbal medications like ginkgo biloba, St. John's wort. Those kind of medications tend to interact with some of this prescription medication. So it could work both ways. Could curb the effectiveness of the medication. It could also increase its side effects, which could lead to more increased consequences as a result of those medical consequences as a result of those side effects. So we basically have to be much more open with our practitioners, our providers, so that they could actually help you, the consumer, and the patients, to get improved quality of life without predisposing yourself to harm.
That's good. So, well, generally, we're running out of time. When people are addicted or abusing some of these medications, the treatment modalities, there are some you may need to go through some detox, inpatient detoxification, and or sometimes also there are long-term treatments. You can use things like Suboxone for opiate dependence, and also naltrexone, Narcan, which can also be used. But also good to use are things like behavioral therapy, cognitive behavioral therapy, which help people to change the unhealthy patterns of behavior and thinking, and teaching people strategies on how to manage the cravings, because once you are addicted to opiates, people have a lot of craving, they go through withdrawals, abdominal pain, diarrhea, so they quickly go look for something to, and once they take it, it's so magical, those symptoms go away. So these are the problems, but they are treatable. Go to a trained personnel, a trained physician, provider who can help you take care of that. Now, hey, I see Joseph Abba. Thank you for tuning in today. Prince, you are a pharmacist. In your pharmacy, what kind of medications are out there that if people are looking for a place to fill their medications, they can come fill at your pharmacy?
Well,
you say you're a specialist pharmacy, right?
Yeah, we as specialists, we do hard to get medications, compounds, fertility drugs, specialty drugs across the boards, even the pain management medication, once it's legit.
Right.
Once it's legit. But apart from that, you know, it's a full-fledged pharmacy where we actually strive to make your pharmacy experience, your shopping experience kind of very easy and pleasant for you. So feel free to come to Paddock Healthcare Pharmacy. It's a one-stop shop. Pharmacists who care.
That's good. Hey, and I know, you see, one of the things I do in my practice is sexual problems, premature ejaculation, as well as impotence, erectile dysfunction. Do you have things out there that people can come get from your pharmacy?
Sure, both prescription and supplements.
Supplements. Do those supplements really work?
Well, they call supplements.
We have
to be very careful, basically, on what our claims will make. But they do help. They're good adjuncts to whatever you're being used. They do have less instance of side effects and interactions with major medications. So feel free to come by for Paddock Healthcare Pharmacy or visit us online at www.paddockhealth.com.
Well, guys, thank you so much for staying with us today. My special guest is Dr. Prince Adekoya. He is the president of Paddock Healthcare Pharmacy, a specialist pharmacy right here on Bladensburg Road, Annapolis Road, in Maryland. His phone number is 301-277-7107. Thank you very much, Dr. Prince, for coming.
Once again,
I'm your host, Dr. Theo Swala, a psychiatrist. My office is on Annapolis Road as well, opposite of Prince's Pharmacy. Office phone number is 301-577-9111, 301-577-9111. Thank you for tuning in. Next week, we're going to be talking about opiate use, opiates use disorders, which is another big thing. Even though we talked about it briefly here, but I have a specialist addiction therapist, a psychologist, who will be with me to talk on treatment of opiates. Thank you for tuning in. See you again next week, same time, Thursday at 1 p.m. Thank you. Have a nice, wonderful day. Bye-bye.